Impact of the Affordable Care Act on healthcare access, cost, and quality. The ACA provides comprehensive healthcare coverage to U.S. citizens by reforming essential components of care which aim to improve quality, access, and cost. Newly covered members of the ACA include full-time employees, adult children with the expansion to 26 years of age, individuals with pre-existing medical conditions, spouses of covered employees, and families that income is below 138% of the poverty threshold. The ACA will achieve health insurance coverage for nearly 94% of the American population through a legal mandate, which will make it a requirement to have some form of healthcare insurance in the U.S. Healthcare exchanges are also called healthcare marketplaces. They are a one-stop market for insurance products. Citizens can learn about health coverage options, compare health insurance plans, choose a plan, and then enroll in coverage all within the healthcare marketplace. Compliance with the ACA required states to have healthcare marketplaces by October 1, 2013. If the states did not meet this requirement, they have marketplaces ran by the federal government. The insurance plans offered in the healthcare marketplace must have 10 essential health benefits. Some states have created state-run exchanges, and some have allowed the federal government to run them solely, while others have formed partnerships with the federal government, which will still allow states to make key decisions and tailor their marketplace to local needs and market conditions. The map below shows current health insurance exchange structures across the United States. The ACA has expanded Medicaid insurance to all Americans under the age of 65 and whose family's income falls below the poverty line. The ACA also makes it easier for those eligible for Medicaid and CHIP to apply and enroll with newly created affordable insurance exchanges. Ultimately, Medicaid expansion as a result of the ACA has had positive impacts on coverage, access to care and utilization, as well as economic outcomes, including impacts on state budgets, the payer mix for hospitals and clinics, and employment and labor market. Medicaid and the CHIP provide health coverage to over 72 million Americans, including children, pregnant women, parents, seniors, and the disabled. The ACA provides states the opportunity to expand coverage for Medicaid recipients. Under the ACA, states will receive 100% of federal funding for the first 3 years to support this Medicaid expansion, and then 90% federal funding after the first 3 years. Since 2003, premiums have increased 80%, nearly 3 times as fast as wages and inflation. The ultimate cause of high insurance premiums displayed through the ACA is due to the requirement for insurers to cover high-risk consumers. Additionally, ACA coverage expansion will result in cost shifting since expansion will be paid by reducing payment to hospitals and providers. The likelihood of cost shifting will cause health insurance premiums to increase in employment-based and exchange-based plans. Insurance companies are ultimately affected because if they spend more than 20% of premium dollars on expenses other than healthcare costs, they will have to send out rebates for the difference under the 80-20 rule. The most prominent implementation challenges facing the ACA is it being considered unconstitutional, lacking public acceptance, hurting small businesses, and polarizing politics. There is only a third of Americans who believe the ACA will directly benefit them. The senior citizen population expressed concern that the increased number of people eligible for Medicaid would deplete resources available for them. There are many people who believe the ACA is unconstitutional. The below lawsuits include information on the ACA expansion and coverage. Along with the other implementation challenges, the ACA has a stigma for hurting small businesses. For instance, a company with a minimum of 50 full-time employees are now required by law to provide health insurance. Those who fail to do so will be penalized.
Secretary Sebelius, I, of course, have to start with the Patient Protection and Affordable Care Act. It is not a simple piece of legislation, not simple to implement. But I wonder if you would tell us, as the implementation has been going along for 3 years now, what has been unexpectedly difficult and what perhaps has gone more smoothly than you anticipated when the President signed the law?
Well, I think that probably no one fully anticipated, when you have a law that phases in over time, how much confusion that creates for a lot of people. So that has been difficult. When the law was signed and people immediately did not get affordable health insurance, they were surprised and a lot were disappointed. But now understand that this is a gradual phase in, and the full implementation won't be until 2014. I think that the second thing that probably has been more difficult is just the politics. It has been relentless and continuous. And I would say, I think there was some hope that once the Supreme Court ruled in July, and then once an election occurred, there would be a sense that this is the law of the land, let's get on board, let's make this work. And yet we find ourselves still having sort of state-by-state political battles, and again, creating what I think is just a lot of confusion. It's very difficult when people live in a state where there is a daily declaration, we will not participate in the law, for them to figure out whether or not there are any benefits that they will actually have a right to access. And so getting that word out, setting up the infrastructure has been more complicated. I would say the good news is that we already have millions of people who are benefiting. We know that about 6 million young adults, and young adults were the second highest age group of uninsured Americans prior to the passage of this law. So about 7 million young people now are on their parents' plan, and that will continue on. And that was done almost overnight. We have millions of people, probably 70 or 80 million, who now have preventive services with no copays and no coinsurance and are taking advantage of that, whether they're in Medicare or in private insurance companies. Again, I think that was rolled out with very little fanfare. Medicare benefits have actually increased, so seniors are seeing a 50% discount on brand name drugs. They have better choices in Medicare Advantage and are paying lower prices. So some of those things are actually taking place, rolling out without, again, a lot of difficulty, and very exciting initiatives underway through our Innovation Center, which is kind of the research and development arm of CMS, which has never existed before, testing ways to improve the quality of care and lower costs at the same time. And we've got some early, very promising results. So those pieces of the puzzle are working. We've got a really, I think, terrific framework, and now we have the last final big piece.
The political debate over the impact of the ACA involves Americans' interpretation regarding their entitlement and right to receive the highest level of health care at a low cost. Additionally, the most obvious variable at play includes the expansion of Medicaid, specifically when states opt out of Medicaid expansion. This causes challenges between the state and national policymakers because it will leave the federal government in charge of providing subsidies to consumers, which will place a huge burden on taxpayers. The ACA impacts 5 major factors on healthcare costs, including age, geographic location, tobacco use, individual versus family enrollment, and plan categories. The ACA addresses individuals having access to the same care instead of some level of care. The ACA is a good law because it has provided coverage to nearly 94% of the U.S. population, increased the amount of insurance plans provided by companies, and has eliminated the ability for companies to deny individuals insurance if they have poor health or a pre-existing condition. According to the United States Department of Health and Human Services, the ACA is working, and since implementation of the ACA, there has been improved patient safety, higher quality of care, and the price of healthcare has risen at the slowest rate in 50 years, making healthcare more affordable. While it will not provide a universal healthcare coverage, it has taken huge strides to give U.S. citizens a chance to obtain quality and affordable healthcare. The chart includes a poll completed by the Kaiser Family Foundation, and which includes individuals who say they have benefited or been negatively affected by the ACA. Additionally, this poll completed by Gallup includes Americans' views of the Affordable Care Act from 2013 to 2015.
North Carolina showcases all that Obama wanted his new health care system to do. The main goal of the Affordable Care Act was to make insurance available to people who didn't have it, creating a new safety net for millions nationwide. In North Carolina, people flocked to the program. More than 600,000 people there signed up for Obamacare policies in 2016, and roughly 90% of those got financial help to pay their insurance bills. Thanks to the act, the number of people without health insurance in North Carolina has dropped by 30% in the past 3 years. Far more people are covered, and far more of them can afford their health insurance. On the other hand, insurance companies doing business in North Carolina have had financial difficulties. United Health Group, the nation's largest insurance company, is pulling out of the Obamacare business in North Carolina next year. And Blue Cross Blue Shield in North Carolina reported that losses on its Obamacare business in 2014 and 2015 topped $400 million.
Thank you for taking the time to view our presentation.